Hey everybody, it's Mike here. It's my Sunday update. I told you I'd bring you one every Sunday, so we'll go over the update on where we are on the state of emergency, some things happening in the community, and then some calls to action. Just to give you a week review of kind of where we started with numbers last week and where we are today. When I came to you last week, there was 232 total cases, 6 total deaths, 33 hospitalizations, and 9 that had totally recovered. A week later, we're now at 593 total cases. Yesterday was our largest single day thus far. 4 total deaths, 95 hospitalizations, and 71 total recovered. I've heard some folks from our district whose loved ones have come down with COVID-19. So keep everyone in your thoughts. Stay at home, comply, and let's do what we can do individually to get through this. For all the updates, go to coronavirus.delaware.gov. That's coronavirus.delaware.gov. I'm on weekly calls with the hospital as a member of the health committee. They have gone through great lengths to get up and moving in case the models show that we're going to be worse than we were than they anticipated, or if it's going to be not as bad. But the ventilators are getting made. Bloom Energy is actually helping with some of that. Beds, reached out, and the Votech schools have offered some of the ones that they use for their dental program and others. So I think, from a preparation standpoint, we're actually in a pretty decent position compared to some other states. Where we are on the state of emergency, out-of-state travelers were ordered to immediately self-quarantine for 5 days. That was the 7th modification that came last Sunday evening. So child care sites, they were designated as emergency for essential personnel, which means that child care sites can only operate if they are designated through the state as an emergency child care site. I know I've had a lot of emails and calls from folks on how that affects them as single parents and others. So feel free to keep reaching out to me with questions and concerns on that. But we've seen a lot of child care facilities closing temporarily and others designating themselves through the state in order to do that. That was the 8th modification. The 9th modification actually had to do with public gatherings and businesses. So the 9th modification had to do with public gatherings of no more than 10, which follows the CDC recommendation. And it also gives the businesses specific guidelines so that there's no more than 20% of stated fire code capacity in their business at one time, or 10% when it's during a specific time for vulnerable populations, like the grocery stores from 6 to 7 at Zingo's, or Acme from 7 to 9, for instance. Businesses also had to clearly mark 6-foot spaces in checkout lines and other high traffic areas. That includes outside areas. Again, that was the 9th modification. So the state of emergency, I'll keep updating you with that via Facebook and my newsletter throughout the week. Sorry if you hear the pitter patter of my dog's feet. They're having a lot of fun today. Another thing, in partnership with Representative Kim Williams, Senator Anthony Del Colo, and Senator Jack Walsh, we've created a food bank distribution remote site. Thank you to Representative Williams for her leadership in this capacity. Her and I were both trying to help out others who were food insecure and came up with this idea, and appreciate her leadership in helping get this done. It is by appointment only, so send me a message or an email for qualification standards, and we'll try to get you all set up. I'm chairing the Small Business Relief Task Force, so we had almost 100 business owners from around the state. It's primarily designated for District 22, so we had almost a third or more of those businesses from District 22. The idea is to give recommendations to the governor for relief efforts in our state. We heard from the SBA and we heard from the Division of Small Business. The SBA, one takeaway is that they're having 4 calls a day to help business owners. So there's a lot that's coming out after the stimulus package from the federal government. They're trying to walk everyone through that. Some banks are ready, some banks aren't. They're helping everyone kind of walk through that and answer questions, so you should take advantage of that. And I'll post the schedule and numbers in the comments section. Also email me if you'd like to see that. I've posted on Facebook and it's been in my newsletter. I'll be having a community Zoom meeting on Wednesday evening at 6 p.m. keep a lookout for that. I'm going to have special guest Jennifer Horney from the University of Delaware. She's the chair of the new epidemiology program. There's a lot of science and numbers and everything behind all of this. I know it's led to a lot of questions. So Jennifer will be on to discuss what it all means and help you understand the modeling and other things better. So a great opportunity for you to call in over the phone or join us via video on Zoom on Wednesday evening. On Tuesday, we will have our second Small Business Relief Task Force meeting at 1:15 for business owners. We will have Saron Cade, who's the Secretary of Labor, on that call with us. They have been absolutely inundated with unemployment requests. So if you are having a hard time getting in touch with them, please contact me and I'll help you navigate. But also just please understand that they also didn't have the workforce capacity in order to have this volume. So they're doing the best they can. So everyone, if they could please have patience with them. I'm also collecting PPE items, masks, gloves, Tyvek suits, and other things for our first responders and for long-term care facilities. Those are groups that aren't necessarily being forgotten, but groups that are getting smaller donations given to them from time to time. And with donate.de.org, most of those items all go into the hospital. So I want to help our first responders locally in our long-term care facilities and then push it out. Can't thank everybody enough for what they've given so far, so continue to do that. We've had a lot so far, and we'll be able to give our first set of items to Little Sisters of the Poor, who's been going through a tough time, and Aetna Fire Company and EMS. So thank you for all of that. I mentioned the SBA. Try to stay connected with them for their 4 calls a day through these challenging times. And then last but not least, I just want to give you some calls to action for the week. One is social distancing. There's a lot we do not know about COVID-19 and this coronavirus, but the one thing we do know is that social distancing works. So do it. Stay at home, help others, limit their exposure, especially older populations and folks with chronic disease. Just adhere and comply, and we'll get out of this sooner rather than later. It's a challenging time, but we have to be selfless and not selfish in these situations, so please comply. I mentioned the older adults, 65 and older are high risk. It's a great opportunity to get back to our fundamentals and being good neighbors. So if your neighbors over the age of 65, see if you can help them, give them a mask, see if you can go to the grocery store for them, see if you can go to the pharmacy for them. Do everything you can to help them. We need to limit their exposure, okay? And then the quote of the week is the best way to find yourself is to lose yourself in the service of others. Try to help somebody this week, donate some PPE, donate some food. Let's help the folks that are food insecure. Let's help our frontline workers. Thank you to our nurses, our doctors, our teachers, and everybody that is doing their best to adapt in these challenging times. Hope you'll join me for one of my meetings this week. Thanks so much. I hope you have a great day.